Hi, I'm Dr. Aidoo with the Department of Anatomy and Cell Biology, School of Medical Sciences, University of Cape Coast. I'm pleased to bring to you Embryology of the Eye. The eyeball has the fibrous tunic, vascular tunic, and the retina. The fibrous tunic is made up of the sclera and cornea. We will soon see the origin. The vascular tunic is made up of the iris, ciliary body, choroid. And then the retina has two layers, an inner layer known as the neural layer, and then you have the outer layer known as the pigmented layer. Now when you look at the anterior portion of the eyeball, you have this cornea. Just posterior to the cornea is a space or a chamber known as the anterior chamber. This anterior chamber contains a fluid known as the aqueous humor. Then, posterior to the lens, in this big cavity, which is the posterior chamber, contains the vitreous humor. That is the retina, which continues as the optic nerve. We will soon look at its journey to the brain. The eye comes from 3 or 4 sources depending on how you count them. So if you count them as ectoderm, mesoderm, and neural crest cells, we are going to have 3 sources. However, the ectoderm is divided into 2. You have the neuroectoderm and then the surface ectoderm. So if you count it that way, you are going to have neuroectoderm, surface ectoderm, mesoderm, and neural crest cells, making 4. The neuroectoderm forms the retina, the posterior layer of the iris, the optic nerve. The surface ectoderm forms the lens and the corneal epithelium. Note that this is epithelium, corneal epithelium, because you also have corneal endothelium. The mesoderm forms the fibrous and vascular coats. Then the neural crest cells will differentiate to form the choroid, sclera, and then the corneal endothelium. So that is what I was alluding to earlier. The neural crest cells usually migrate to the mesenchyme of the mesoderm to form the choroid, sclera, and then the corneal endothelium. And so you will come to appreciate that the vascular and then the fibrous coats also contain the choroid and then the sclera. In the 4th week, it's a very crucial time for the development of major organs. So I talked about this in the video. That is actually an audio. The significance and role of folic acid in embryogenesis. I captured the importance of the 4th week. Now this week marks the first sign or indication of the formation of the eye, and this occurs in the prosencephalon of the forebrain. Again, I've covered the development of the brain in another video. The first sign occurs as a sulcus or a groove known as the optic groove. Because the eye is a pair, we call the grooves the optic grooves on the left and right side of the head. So this blue color is the neuroectoderm, and you can see that there's a groove, which means that you have a downward growth or an invagination. Okay, so that forms the optic groove. That is the neural fold which will contribute to the formation of the forebrain, and for that matter the prosencephalon. You have mesenchyme, and then you have the surface ectoderm, which is continuous with the neuroectoderm. The optic grooves will now invaginate to form optic vesicles. I have underlined the E for you to bear in mind that this is evagination and not invagination. So you can see that the hitherto groove-like optic groove is now projecting outward. So there's an evagination, an outward growth. All right. Now, once that happens, the groove changes the name from optic groove to an optic vesicle. Okay, and the plural will be optic vesicles. This will enlarge, and its connection with the forebrain will constrict to become the optic stalk. So here you can see that there is a constriction of its connection to the forebrain. Remember, we said that the sulcus or the groove occurred around the prosencephalon of the forebrain, so there's a continuity. Now, this slender portion, due to constriction of the connection of the optic vesicle and the forebrain, becomes the optic stalk. You can see that the surface ectoderm is very close to the optic vesicle. So now the optic vesicle, as it evaginates, grows towards the surface ectoderm and then creates a close contact with the surface ectoderm. Later, the surface ectoderm will thicken because of the inductive effect of the optic vesicle. It thickens to form the lens placode, and this lens placode will later develop into the lens. So you can see that the lens placode also has an invagination known as the lens pit. The lens pit has a continuous growth, that is a continuous invagination, and as it continues to do that, the upper portions that are in close contact with the surface ectoderm come face to face, that is, they grow towards each other, just like the neural tube formation. During the formation of the brain, you have the neural tube also forming folds that grow towards each other. It's a similar phenomenon that is occurring here in the lens vesicle. Once that occurs, the lens vesicle severs its continuity or connection with the surface ectoderm. So it tears off essentially to form a spherical structure. Now we go back to the optic vesicle. So we have two vesicles here, an optic vesicle and then a lens vesicle. The optic vesicle would develop into the retina, and then the lens vesicle will develop into the lens. When you look at this optic vesicle, you realize that it has two layers, an inner layer and then an outer layer, and in between the two is a space. The space is going to form the interretinal space, and we will soon give names to the inner layer and then outer layer. Remember when we looked at the eyeball in the first few slides, we looked at or mentioned that the retina has two parts, a pigmented portion and then a neural portion. So this is an indicative of how the inner layer and then the outer layer contributes to the formation of the neural layer and then the pigmented layer respectively. So the lens vesicle has an anterior wall and then a posterior wall. We are talking of the lens vesicle this time. Once the lens pit grows and invaginates deeply, the two edges or ends here, which is in continuation with the surface ectoderm, come together, and then once they meet, they sever their relationship with the mother that gave rise to them, i.e. the surface ectoderm. Now when that spherical mass is formed, you have an anterior portion here and then a posterior portion. The anterior portion is related to the cornea or the surface ectoderm. That anterior surface is made up of cuboidal cells, and that forms what we call the lens epithelium. Whereas the posterior layer, which contains columnar cells, becomes the primary lens fiber. Primary lens fiber. So you have the lens epithelium coming from the anterior cuboidal layer, and then the primary lens fiber coming from the posterior columnar layer. If you have forgotten your basic histology, go and look at the video on epithelium to refresh your mind. So you have columnar cells, as you can see, and then cuboidal cells. So that is how the lens begins its maturation. Inside or between the anterior and posterior layers is a cavity. Now what happens is that the anterior layer will continue to grow and fill up the cavity here. And once that goes on, there is the demarcation, okay, of a layer in between the anterior and the posterior. It's like the midline of the anterior layer and then the posterior layer forms an equatorial zone, okay, equatorial zone. This equatorial zone is going to help form what we call the secondary lens fibers. Secondary lens fibers. So that is what you see here. Okay, there is line indicating the equatorial zone will form the secondary lens fibers. The secondary lens fibers actively form even in adulthood. So even in an adult, you have active development of the secondary lens fibers. However, the primary lens fibers are fixed. They no longer grow, and it has to last your lifetime. When you look at this portion of the neuroectoderm, you can see the optic vesicle, as we said, coming from the optic groove. Okay, so this is an evagination. It grows outwards, and then later it forms the cap stage, and then grows inwards. All right, and this growth or the cap stage is similar to the tooth development, which was also covered in another video where you have the cap stage and then the bell stage preceded by the bud stage. So you realize that there is a space at the posterior portion of the optic vesicle due to the invagination of its layer. You are going to have two layers eventually. So those two layers will be the outer layer and then the inner layer. The outer retinal layer and then the inner retinal layer. In between is the interretinal space. You can also see that the developing lens, which is the lens vesicle, is in close association with the inner layer of the retina. However, as time goes on, a space appears in between the developing lens and, for that matter, the posterior portion of the lens and then the inner portion of the retina, which becomes the vitreous body. Okay, you remember I mentioned that in the first few slides. But the interretinal space still persists. Now the outer layer of the retina is the pigmented layer, and then the inner layer is the neural layer. I want to add that the optic stalk, which is the concentration between the developing eye and then the forebrain, will carry the optic nerve. The optic nerve is the cranial nerve 2 and is going to move as the optic nerve posteriorly and then form the optic chiasma, and beyond that it goes on as the optic tract. This optic tract will go all the way to the lateral geniculate body, where it will sign up with a second order neuron, and these second order neurons will radiate in the form of the optic radiation into the primary visual cortex. I think you should also appreciate the fact that the superior colliculi also help in positioning the eye in receiving the best stimuli. So note the importance of the optic stalk and then what it carries. Apart from it carrying the optic nerve, it also contains the hyaloid vessels, which are actually blood vessels. Then we come to the cornea. It's very easy to remember this because it's similar to the three sources we mentioned for the development of the eye. You have the surface ectoderm, which will form the external corneal epithelium. You have the mesoderm, which will contain the mesenchyme. Then the neural crest cells, which will form the corneal endothelium. I hope this lecture has helped. I want to thank you very much.